I wanted to talk to you about the Restrictive Interventions Committee. So this is a really important committee that I sit on, along with people from family carer supporter perspective, and also people who bring a clinical perspective as well. So, of course, when we're talking about restrictive interventions, I'm going to name them now, just to give you some warning. We're talking about seclusion and also restraint, whether that's physical restraint or chemical restraint. So this committee, I'm actually subject to quite a strict confidentiality agreement around the data that I see in this committee. That's a little bit difficult for me because ideally we would share everything with you, our consumer community. But nonetheless to say that we're all working on what the Royal Commission has outlined as a 10-year goal of elimination of seclusion and restraint. So I can talk generally about seeing data over time, of course, and across services as well. A lot of this data is public, and we have made it particularly public in our seclusion reports, of which we've done 3. Most recently launched in June last year was our seclusion report number 3. And we've had good interest from many of you around that, including attending our launch. And we've also had engagement from clinical services who got in touch with me and to talk about their numbers and indeed the story behind their numbers. So if I can add to that and to say our position is clear about elimination of seclusion and restraint, and where the seclusion report is going is now it's going to be a collaboration between government, family care perspective, and of course the consumer perspective. So the activism we've done in having 3 seclusion reports has changed the space, and now it's going to be reported, produced collaboratively. Of course, we'll still have a very strong voice around what the data is, but it is going to be a collaborative effort. So for me, just so that you know, I'm sitting in on a Restrictive Interventions Committee. It's of course hard to see that data and hard to know that we as consumers continue to be subject to those practices, which are traumatic, when what we're looking for in our care is for people to be nurturing and the care to be healing. So that's as much as I'll say about that one, and thank you for your interest. And when I have anything more specific that I can talk about, I'll certainly bring this here or make sure it gets out in our newsletter or socials. So just to round that one out, that's been a really big influence that we've had as an advocacy organisation to see now that government realise there needs to be a seclusion report. This data needs to be published in an accessible way, and this will contribute to the elimination of seclusion restraint in the 10-year timeline as outlined by the Royal Commission.